Good day, sir. In this discussion, we will present a comprehensive community-based intervention plan aimed at promoting a drug-free society. Our plan focuses on reducing drug abuse and vice activities by addressing key areas such as prevention, law enforcement, rehabilitation, and community education. We will explore the current state of drug abuse in Davao City, identify key stakeholders, and propose strategies to enhance public awareness, strengthen law enforcement efforts, improve treatment service, and engage the community in prevention activities. By taking a holistic approach, we aim to foster a safer and healthier environment for all. Davao City has experienced significant developments in drug-related activities and enforcement efforts in 2024. In March, Mayor Sebastian Baste Duterte declared a renewed war on drugs, leading to intensified anti-drug operation. This initiative resulted in the arrest of 51 drug suspects and the seizure of approximately 331.3 grams of shabu and marijuana within the first 10 days. However, this aggressive approach raised human rights concern. The Commission on Human Rights, or CHR, expressed alarm over reports of extrajudicial killings associated with the campaign, emphasizing violation of fundamental rights. Despite these concerns, law enforcement continued its efforts. In October 2024, operations led to the arrest of 300 individuals, including 40 high-value targets, and confiscation of illegal drugs valued at over 9 million. The Davao City Police Office reported a 36% decrease in the overall crime rate in the first quarter of 2024 compared to the same period in 2023. However, drug-related offense increased by 11.23% during the same time frame. These developments reflect the city's ongoing struggle with illegal drugs, balancing enforcement with human rights considerations. Drug arrests and seizures. In October 2024, local authorities arrested over 300 individuals, seized significant quantities of shabu or methamphetamine and marijuana, and dismantled numerous drug operations. These efforts illustrated the ongoing struggle to curb the growing number of drug-related incidents.
Case studies. Rehabilitation struggles. Davao City's rehabilitation centers are overwhelmed, highlighting the lack of sufficient facilities and programs to address the needs of individuals recovering from drug addiction. Many rehabilitation centers face overcrowding, which hampers their ability to provide quality care. Next is the success stories. Despite these challenges, some barangay lead rehabilitation programs have shown success. Programs offering counseling, vocational training, and peer support have helped some individuals successfully reintegrate into society. Existing programs. First is the Barangay Anti-Drug Abuse Councils, or the BADAC. The BADAC are essential in monitoring and implementing local drug control programs. These councils work closely with law enforcement agencies to reduce the supply of drugs and offer community-driven prevention programs. Next is the Community-Based Rehabilitation Programs, or CBRP, offer an alternative to detention for those struggling with addiction. These programs, while effective at local level, are often limited by resources and face the challenge of reintegrating recovering individuals back into society. Key stakeholders and resources available. Effective drug abuse prevention requires coordinated efforts across multiple sectors. Davao City has a range of stakeholders actively involved in the anti-drug initiative. Local government. The city government, led by the mayor's office, is responsible for overseeing drug control programs, allocating funds for rehabilitation, and ensuring that local policies are enforced effectively. The mayor's office has also initiated localized programs that target neighborhoods with highest level of drug abuse. Next is the law enforcement. The Philippine National Police or the PNP and the Philippine Drug Enforcement Agency, the PDEA, are key actors in the anti-drug war, conducting raids and apprehending offenders. Their efforts are supplemented by community policing, where local police officers work with barangay officials to build trust and share intelligence. Next is the non-governmental organization or the NGO. NGO is in Davao City, such as the Philippine Business for Local Progress, the PBSP, provide critical support for rehabilitation and offer programs focused on education, counseling, and vocational skills training.
Religious and civic groups. Churches, local community leaders, and civic organizations also play an important role by advocating for moral reform, providing safe space for youth, and leading public education campaigns on the dangers of drug abuse. Strategies to prevent drug abuse. Preventing drug abuse requires a multi-pronged approach involving education, community outreach, and policy intervention. Public awareness campaigns. Launch citywide campaigns that utilize mass media, social media, and community events to spread information on the dangers of drugs. These campaigns should include testimonials from former addicts, public service announcements, and interactive online platforms to reach a broader audience. Organize anti-drug rallies, sports events, and community activities aimed to engaging youth and raising awareness about drug abuse. Educational programs. Integrate anti-drug content into school curricula, focusing on early prevention and the effects of drugs on physical and mental health. Schools should offer workshops and seminars for both students and parents, teaching them how to identify warning signs of drug use. Peer-led educational campaigns can be especially effective where recovered drug users or students who have resisted drug use share their experiences. Community outreach. Support local initiatives such as youth mentorship programs, alternative recreational activities, or sports, arts, and life skills training, which provide young people with positive alternatives to drug use. Strengthen barangay programs that offer drug prevention service at the grassroots level, including counseling, outreach, and community surveillance.
Strengthening law enforcement efforts. To ensure that law enforcement is both effective and fair, several strategies should be considered. First is improve partnerships with local police. Establish community police partnerships where police officers engage with local communities to build trust and address concerns related to drug abuse. This includes setting up local crime watch groups and creating regular platforms for dialogue between residents and law enforcement. Use of technology. Implement surveillance system in high-risk areas, especially drug hotspots, to monitor and deter criminal activity. Develop mobile apps that allow for anonymous reporting of drug activities and the ability for community members to alert authorities about suspicious activities. Community policing. Emphasize the importance of community policing in the fight against drugs. This involves foot patrols by local officers in neighborhoods with high drug use and trafficking to increase visibility and deter illegal activities. Is enhancing treatment and rehabilitation services. Effective rehabilitation is essential in ensuring that drug users have a chance at recovery and reintegration in society. Counseling services. Expand community-based counseling services that offer both group and one-on-one therapy. This should include family counseling, which plays a crucial role in recovery by strengthening family support systems. Increase mental health support, as many drug users also struggle with underlying psychological issues such as depression and anxiety. Medical support. Davao City should invest in more detoxification and rehabilitation centers to accommodate the growing number of drug users needing treatment. Provide medical care and access to substance abuse treatments at local health centers for those unable to afford private rehabilitation services.
Reintegration programs work with local businesses to provide job opportunities for former drug users, offering them a fresh start and the chance to contribute to society. Next is to provide vocational training, education, and skills development programs that can help former users secure employment and avoid falling back into the drug trade. Next is the community education and involvement. To build long-term sustainable change, it is crucial to educate and involve the community at all levels. Next is the public education programs. Organize an annual anti-drug month with activities like workshops, seminars, art contests, and debates, all designed to foster public discourse on drug-related issues. This can serve as a platform for community members, experts, and former drug users to share experiences. Next is the citizen empowerment. Train community leaders, teachers, and parents to recognize early sign of drug use and understand the resources available to them. This empowers individuals to take proactive steps in prevention and intervention. Next is establish peer-led education programs where recovered addicts serve as a role models and mentors to at-risk youth. Next is the family community engagement. Strengthen the role of the family in the prevention of drug abuse by providing family counseling services and parenting workshop. Next is to empower barangay officials with the knowledge and resources to address drug-related problems within their communities, encouraging them to be at the forefront of local prevention efforts. In conclusion, promoting a drug-free society in Davao City is not a task for any single entity but requires collective action from the government, law enforcement, NGOs, and the community. By adopting a holistic approach focused on prevention, rehabilitation, law enforcement, and education, Davao can reduce the prevalence of drug abuse and improve the quality of life of its residents. This intervention plan offers a clear roadmap for a future where drug abuse is minimized and healthier communities thrive.